dos, uno. Hello, everyone. Welcome to this special conversation on National Latinx AIDS Awareness Day, a day that is celebrated each October 15 to educate and talk about HIV and the Latino community. As part of this Awareness Day celebration that we are hosting today, it's a candid conversation with national leaders to talk about where we were and where we are now. This webinar is produced in part with the NLGJA, the Association of LGBTQ Journalists, the Centers for Disease Control, and Honor 41. And talking of Honor 41, I will introduce our moderator, Alberto B. Mendoza. He's the Executive Director of the National Association of Hispanic Journalists and also the founder of Honor 41. Alberto.
Thank you so much, all of you, for participating in this important conversation today. I think I shared with the panelists earlier that I first learned about LLEGÓ through some of the 41 List interviews, where there was a conversation that was held in real personal regard about our past and about the efforts of a national organization that was about Latinos, and in this particular case, stepping up to do more work about Latinos and is it related to HIV and AIDS. So today's conversation is going to be looking back at that important pioneering work, also looking at how it really shaped the leadership that many of you really continue to bring forward to all of our national work. And then we'll also talk about specifically how HIV and AIDS is impacting our communities today. I mean, we know that that's still an issue, but we also want to acknowledge that we can't really come up with a plan of the future if we don't acknowledge some of the things that we've done in the past. And while we can improve them, there is no future without acknowledging the past. And so we're going to have an opportunity to hear a little bit more about that. And we're going to start with Laura and Leticia. Let's each have you introduce yourselves and start also talking about how did LLEGO get started and how did it evolve to the point where it really became something that was a national platform? Laura?
Oh, go ahead, Letty.
Okay, so I'm Letty Gomez. I'm originally from San Antonio, Texas. I live in Washington, D.C. now. And, you know, this weekend we celebrated 33 years since the National March on Washington for Lesbian and Gay Rights that was held here in Washington, D.C. in 1987. And it was that weekend that I really began to get involved with what became LLEGO. We had an encuentro here in DC, and so we'll talk about that in a bit. And I'm also the co-editor of the book Queer Brown Voices, yes, published by UT Press in 2015.
Someone should hold it up because there's a couple of people that are a part of that. Thank you, Letty. Laura?
My name is Laura Esquivel. It's so wonderful to see everybody. I am currently the Vice President for Federal Policy and Advocacy for Hispanic Federation. I have been professionally organizing, advocating, strategizing politically, and just all-out troublemaking as an out lesbian Chicana for 40 years. I've been out longer than that, but that's how long I've been an activist. Before joining Hispanic Federation, I worked at the Gay and Lesbian Victory Fund and Gay and Lesbian Leadership Institute. Born and raised in Los Angeles, I've been here in DC for 18 years. I'm a co-founder of LLEGO and very proud of that.
Wonderful, thank you so much. Octavio and Jose, I'm gonna have each of you also introduce yourselves, but also tell me a little bit about what it meant for you at the time to come across an organization that was specifically about Latinos and the impact that it was having on gay men and HIV. Jose?
Okay, hi everybody. Thank you for the opportunity. Thank you for having me. My name is Jose Gutierrez and I'm born and raised in Mexico. And I'm an activist, I'm a poet, I'm a leader. I'm the founder of the Latino History Project, the DC Latino Pride, and I'm a co-founder of the Rainbow History Project. And 2 months ago, I start my own project, Jose Gutierrez Archives, which I'm moving on to be a nonprofit and also to preserve our history. The first I mean, the first thing, my first initiation with LLEGO was when I met Leti Gomez and Martin Ornelas in Atlanta, Georgia. And Leti and Martin, they helped me a lot with technical assistance. And I'm also HIV positive. So for me, that was very important to affiliate with LLEGO, because LLEGO provide technical assistance to many groups in the country, more than 155. And one of the first projects was the TATA project, providing technical assistance and providing grants to our own country, our own groups, and also Culturas Vida, which is another program of LLEGO. But the AIDS epidemic that was affecting our community, our Latinas and Latinos, you know, in the 80s, in the mid 80s. And I have many friends that they passed from AIDS, and including Pedro Zamora. Pedro Zamora was one of the few Latinos openly HIV positive who made a lot of visibility, you know, on the TV. And in that time, we didn't have a lot of resources, you know, we didn't have a lot of education. So that was terrible for our community. I remember that I started taking ACT, you know, the first pill, ACT.
Yeah. Hold on that, because we're gonna tap into kind of the resources and the support, but also let's hear from Octavio and tell us what it meant to you, because I know you also worked with LLEGO, but you did it a little bit on the latter end of that work. So tell us a little bit about what that meant to you, and of course your bio.
Sure. I'm Octavio Espinal. I'm the director of the Office of the President at Unidos US, formerly the National Council of La Raza. Before joining Unidos US, I worked at LLEGO from 2001 to 2004. And I got involved with LLEGO because I was volunteering at the Human Rights Campaign, stuffing envelopes for them, and met Ados, who was leaving HRC to go to LLEGO to be their director of development. And he asked, I met him my senior year in college, and he asked me, when you graduate, give me a call and let's see how, you know, you can get involved. And the day after graduation, I called Ados, and then I had an informational interview the following day. And I just wanted to get involved because, you know, HRC was one thing and it's great, but then Ados explained this whole new world that Latinos and being gay and doing work directly with the community. And that's what attracted me to the organization.
Thank you. I love seeing that a lot of you have these nice smiles when their names are mentioned. And Lisbeth, you're like, I can feel your energy.
Octavio was a baby.
I was a baby. Seriously, right the day after graduation, I was in that office because I was so eager to work for it.
And I love that. See, a true leader does follow up with people when they say, give me a call or follow up, let's help you. But Lisbeth, I want to hear from you about kind of how you're feeling about this conversation, and of course your intro. And then Bambi, I want you to share a little bit about your experience about, you know, you were just coming onto the field and how you've seen HIV and AIDS kind of evolve. But let's start with Lisbeth.
So my name is Lisbeth Melendez Rivera. I am currently a full-time student obtaining my doctorate in ministry. And I, just like everybody else here, you know, there was a mythical thing about LLEGO that has a lot to do with who I am and where I came from. It gave me as a Latina, I had a national platform as a labor leader, as a, you know, in many other ways, but really to be able to have a national platform as a Latina doing work for Latinos with Latinos, you know, around the country. My role at LLEGO was as director of capacity building. I was there also around 2000 to 2004, the beginning of 2004. And I think, you know, one of the reasons you talk about smiling is that I wasn't an old person at that point, but I was one of the oldest people at LLEGO at that point. And, you know, and I was blessed. Like all of a sudden I had the mother of the movement, Laura, and then I was all these babies of the movement, Octavio and you know, Christian and Jose Melendez and all of these folks who literally just graduated from college and all of a sudden had found this organization that was for them, by them, and with them. And what did that mean for everybody, right? And so um, the one thing that I would say that just to, you know, if we can talk about it is, you talked at the beginning about leadership and where, you know, where we are and, you know, where we've gone from there and what it meant for us to be basked by mentors, to be mentors, and to now see that being replicated by others. And so that, you know, from Culturas Vida to the efforts that got put into the aftermath of LLEGO, the people that you see on camera are the people who we continue to go to just to seek guidance. And so, yeah, that's a little bit of what what I'll say for now.
Thank you. And we're going to have more of that. And go back to the original question of how did it get started? Because I think we're all talking about the different perspectives of how you came across the organization, but we definitely want to hear that. Bambi, you know, you talk about, you knew about LLEGO as you were just getting started. And I think that you didn't get to go to the first encuentro because you were just getting started in the work. How did that work or that legacy kind of impact the work that you continue to do through Bienestar and other groups from there?
So,
And introduce yourself.
yes, primero que nada, un abrazo y un honor poder compartir con todas las personas aquí, un abrazo virtual a todas las personas. Y también quiero honrar a mi creador, mi poder superior, por darme la oportunidad de estar aquí con ustedes y un día más de poder tener aliento, ¿no? So, you know, so like, I first started getting involved with Bienestar back in 1997. But it took me another trip to prison, you know, for me to find myself and, you know, get the support that I needed. So I started working in Bienestar in 2000. And so in 2001, I think that's when they had the encuentro. But obviously, you know, my position was at that time an outreach worker, you know, and so there were other individuals who obviously became my sisters, not just in the social justice realm, but and the work also, right? Like Maria Roman and Brenda del Rio Gonzalez, you know, and Leslie Mena, and you know, and like different individuals, right? Different trans women who obviously I admire and I, you know, I consider my sisters. So I knew of LLEGO and I knew of the beautiful and amazing people who were part of it, who continue to be part of my life, right? Individuals here present, Laura and Lisbeth and Jose, and, you know, I mean, obviously Alberto, right? I mean, you know, and so, you know, I think, you know, the fact that we had an organization that was a representation of our people, right, was truly remarkable. And for me, was obviously inspiring. So, you know, I definitely command and respect the beautiful and amazing work that was done, not just through LLEGO, but that continued to build the legacy that through the beautiful people who were present here.
Did you mention that you're the Trans Latina Coalition?
I did not. I did not, but yes. So through that process, right? Like through the process and the beautiful and amazing support and love from different people who are here, I, you know, later down the road, I became the CEO of the Trans Latino Coalition, which is a national advocacy organization that is based in Los Angeles, that also provides life-saving services to trans people in Los Angeles. And we are the first trans-led organization in Los Angeles that is doing this work. So yes.
And not only did you get to it, you founded it. So there was no organization there before that. So let's talk about origins, since there is that key anchor of leadership that's at the base of all of this work. Letty and Laura, I know, Letty, you've been posting pictures of the past, and again, I love seeing those memories. Let's talk about, how did we get to the point where the organization was birthed, per se?
Well, actually, Laura and I were talking about this last night because, you know, in 1987 was the march here in Washington, but the year before in California, there was a Third World People of Color conference for lesbian and gay men. And that's where the idea, the conversation about creating something national for Latinos that were lesbian and gay at the time was created. And Laura, I don't know if you want to jump in here, because that's where it started.
Yeah.
And then the following year, I was in Texas, and we had the Gay and Lesbian Tejano Network, and we had a conference, and we invited Laura and Arturo Olivas from California to come to Austin, Texas, for this conference to talk to us about, continue the conversation about creating something national. And so I'll stop there and see if Laura wants to add anything.
Yeah, I just did the math really quickly. 36 years ago, 35 years ago, whenever 1986 was, it was a long time ago. And people, you know, Alberto, what you do with Honor 41, Jose, with the history, like, you know, people, if we didn't have people who were committed to telling our history and keeping our history, I mean, it was such a different world. It was a completely different world to be open, to be at a time when people were asking you, well, are you going to be a Latino, or are you going to be LGBT? Like, which community are you going to fight for? You know, if you were an activist. And the concept that you could be both and fight for that as one community was really something very new at the time. And we were already leaders, but we were regional leaders. Right? We were local leaders. You know, I was the president of Gay and Lesbian Latinos Unidos in LA. Letty was the president of Gay and Lesbian Tejanos, you know, in Texas. There were in California and Texas in particular, there were a lot of local organizations and statewide organizations, but we didn't have a national voice. And so we were not at the tables where national, the gay movement, right, as it was called then, right? The gay movement was taking off, and it was gaining power, and it was becoming visible, and there were not people of color in those conversations, in those pictures. You know, the idea of what the gay movement was at the time was white people, was white men, honestly. Mm-hmm. And there was no space for us. So we just really felt like there needed to be one. And, you know, Letty was a baby too. She was just finishing grad school when we looped her in to becoming the first executive director, because she was finishing her graduate studies and coming to DC for her first job or first internship. I'm like, well, you're gonna live there anyway. Can you help organize this march? Wow. And so that's how, you know, the handoff to Letty and all the organizing and the founding here happened in DC.
Yeah, and I guess the other thing, Arturo, about that time, and Laura, you know, has described it. So there were all these, at least in California and Texas, and I think in New York and Chicago, there were Latino LGBT organizations that were founded. And a lot of times, I'll tell you from Texas, as a response to the fact that, you know, the white gay community didn't, you know, readily accept this. You know, we would still get carded at a gay bar because we were in Texas, because we were Chicanos, you know, and in some places you get carded because you were Black. You know, you have to present 2 IDs. So even within our community, our gay movement, there was a lot of discrimination and prejudice. And so we had to find those safe places for ourselves. So we had these local organizations. And so we found this was a great opportunity to come to Washington, DC, and to continue this conversation. And I'm just really grateful that we had a collection of people, of Latinos and Latinas, that were willing to, put their blood, sweat, and tears into this, because there was no money. It was all volunteer. And, so I think that it was really a grassroots movement that created LLEGO, and that we all had this shared vision that we had to create a space for ourselves, be visible, and really fight for our community. Because as Laura pointed out, when we walked into a room, it wasn't, I was coming in as a Chicana lesbian. I was coming in as a Chicana lesbian from Texas who happened to believe immigration was an important issue, that bilingual education was an important issue. These were fights that we would have even within the movement, that, that we couldn't talk about immigration. We couldn't talk, but that was all about our community. So it was really important for us to have this platform. So I think that really is why we felt so strongly about creating this national forum.
I'm curious, because Jose talked about his HIV status. I remember when I didn't really know much about AIDS. I heard about it in commercial or something. And actually, I started volunteering at the San Diego AIDS Foundation when I was 16 years old. The only thing I could do at the time was bag the food because I was not 18. My mom had to take me. My mom waited outside for 3 hours and then we'd go back home. But to me, I just always thought, again, there wasn't that visibility of people that looked like me. And I always found that the prevention campaigns and the things that were being done to talk about HIV always ended up looking like white men, or things were translated but didn't make any sense, and they just didn't speak to me. And it in some ways, it almost felt like I had to pick my identity. Either I am Latino or I'm a gay man. And even when I finally came out at 19, I was like, okay, well, in my everyday life, what people see me walk in is well, now probably a gay man too, but a Latino. But the gay part was almost a secondary. And I think we've always had to manage these dualities as we've come up. I'm curious to hear from the folks who were born in Puerto Rico and raised in Puerto Rico, Jose Luis and Lisbeth. What was HIV like there, and how was it being communicated? And then we'll tie it back into the continued work here. Lisbeth?
Jose Luis?
So, yes, in Puerto Rico. Well, you know what? It was not in my family. We never talked about it. I remember that my mom's hairdresser, he had HIV. And that's what was the first time that I knew what it was. But it was very taboo. I mean, I moved to Florida when I was 13 years old. So for me, it was not only that person that I knew, and how healthy he was. I mean, we thought it was a death sentence, to be honest. And but for me, no. I mean, he was healthy, but I cannot really. In my family, we didn't talk about it. I learned more here in Florida.
Lisbeth, in your Honor 41 interview, you talked to me about a real personal story about really how the integration of, the homophobia that happens in our culture and in our families, and sometimes how culture and religion really affect how our families deal with us as LGBTQ and people that need them beyond just what they're comfortable with. Share a little bit about that experience, and then I want to come back to Octavio as well and have him kind of go from when he started to how it developed and what he learned from that experience as we shift the conversation into the national leadership that's happening now. Lisbeth?
So two things were clear. I left Puerto Rico when I was 17, so, yesterday. It's funny because one of the first things, after coming out of the closet that I did was that I happened to be here in 1987, and I happened to see a flyer for the first encuentro, and I just dropped by. Cool. So it was one of those like, oh my God, there's actually this many Latino, gays, like what? But, I was in college. I was, not quite out in Puerto Rico, I went home often. Every time I had time off from school, I would go home. I was lucky enough to have a scholarship that allowed me to do that. It was later, many years later, where my mom and I, back from 87 to 93, where I became the co-chair of the New England Committee for the 93 March. It was through that lens that my mother actually confirmed, because I wouldn't say learned because she already knew, but she confirmed that I was a lesbian. And having to have the conversation once I went home, just like Jose Luis, somebody close to our family who happened to be HIV, and this is now, close enough to the height of the epidemic where a friend of the family went home to die. He literally went home to Puerto Rico to die, and his mother rejected him, closed every door, told him that she would never open the door to the evil that he was, to the sick person that he was, like homophobia and also displays. And I feel for, I feel for that, because it's one of those stories where your heart breaks as to what this mother did, but it's also the reason why my mother loves me the way she does. She couldn't get herself to reject me the way one of her best friends had rejected her son. And so after months of not blessing me, after months of never kicked me out, never, but like that idea that I was not worthy of her blessing, of her, Dios te bendiga, vayas con Dios, like I wasn't a practicing Catholic at the time. And the fact that she didn't do that broke my heart. It broke my heart. And so to have this conversation with my mother about somebody who, my mother didn't quite understand what AIDS was, but she knew that then it was a death sentence. It wasn't it was a death sentence. And that her friend's son died in the streets of New York because his mother couldn't hold him in death, broke her heart. And she made a commitment to herself that she would never do that to me. And so when she said to me that, I know what she did, but I need you to know you are my daughter. I love you. You are my blood. You are my flesh. No matter what, we might differ in opinions and in lifestyles, but I will always love you and I will always support you.
Beautiful.
That is the legacy that carries to the work that I did with my dying brothers, in holding their hands when nobody else would be present, right? And it's very apropos, I'm actually giving a speech tomorrow. It's exactly on this subject and what it meant for me as a Latina lesbian to be working through college at Brigham and Women's Hospital and Children's Hospital in Boston, and having to be the only person willing to take off her protective equipment and hold somebody's hand while they were dying because their families were rejecting it. And my mother made it very clear to me that that wasn't an option.
That to me is also the one thing I hear the most, frankly, about. I mean, I see the leadership in you guys, but the thing I hear the most about LLEGÓ is how it was our lesbian sisters who took care of our dying brothers, who were the ones that were there for our community in a way where our the men couldn't stand up for themselves, and it was the women who carried us forward and pushed, so that stories like that, so they wouldn't be left alone, so that so people didn't suffer in that complete pain alone. Octavio, Jose, and Bambi, do you think things have changed today as it relates to HIV and stigma? Because I think that in some ways, I think we've made a lot of steps forward, but I still find that it's not as far as I thought it would be. Let's start with Bambi, then Jose and Octavio.
So, I can only speak on the trans experience, right? And as a trans, Latina, mujer, emigrante, indocumentada, right? And, when I first, when I first started getting work in a social justice environment, right, it was through HIV prevention. Because even then, in 2000, right, it was the only jobs that a trans woman could get in an office setting or in an organizational setting, right? To me, when I first, walked into the doors of Bienestar, right, and when I saw trans women facilitating groups and really portraying this, professional life, right, that to like I've never seen that before, right? And so, like now many things have changed since in 20 years, right? Since 2000 to now, right? Just to give an example, for instance, right? We have been advocating at the federal level, right, for us not to be included with men who have sex with men, right? And CDC just released a grant announcement, PS 21, in which, they're including us with men who have sex with men, right? And so we have learned, right, for us to create our own paths, right? And for us as an organization, the way we're looking at HIV prevention is looking at it in a holistic way, really, right? Because even in the HIV world, right, like people talk a lot about social determinants of health, but they do very little to support trans people to address the social conditions or the social issues that we face, right? Like discrimination in employment or discrimination in housing, or or even having the opportunity to have lived dignified lives, right? And so the way we do the work at an organization, both at the macro and the micro level, right? Because we know that if we are able to provide, even if it's one lunch hot meal to a trans person, that's an HIV prevention form, right? If we are able to place someone in emergency housing who's homeless, right? That's an HIV prevention method. And so that's how we look at HIV prevention, and through the work and through the work that we've done and just in 4 years, because the Trans Latino Coalition got our first grant in 2016, right? We did a lot of volunteer work, but in 2016, we got our first grant. And we have built in Los Angeles a multiplicity of services, we have legal services, transitional housing program, workforce development. We give lunch every day. We give hygiene kits. We have an anti-violence project with legal services, and we also do policy, And so what we've learned is that for us, like, not even the government is supporting us for us to be at a better place within our society. So we have to, just as we were talking about LLEGO, right? Like how the LGBTQ Latinx community, right, created this path for us to really find our place, right? Like that's how we also as trans people are building our movement, and our organization has been influential in the trans movement across the United States.
Thank you. That's one of the things that why I also started Honor 41 was because we're not covered. Our stories are not told unless it's some kind of drama, crime, sex, but nothing are we ever portrayed in a positive way, especially, Latino media still laughs at us. Mainstream media doesn't cover us. The gay white media doesn't cover us. And I thought, okay, maybe I'm jumping the gun, but even the massacre of El Pulse didn't cover and whitewashed all the Latino, took out all the gay. They created this whole narrative. Like, what about the people that actually went through this? Jose and Octavio, let's hear from you guys also about what that was like for you then, and as you're both in DC and looking at the incredible work that's happened, what's still happening today that is connected to the past, and what are some things that are still missing?
Octavio?
Go ahead, Jose. I can just add on to what you have.
Okay. Well, okay. So, yeah, for me, this is like the second epidemic, the COVID-19 and also the HIV/AIDS epidemic. I do remember that when my family and we moved to Atlanta, Georgia, I started working as a volunteer in an agency called AIDS Atlanta. And then many of my friends, they start dying, Puerto Ricans and Mexican friends. And I get my first scholarship from my mentor, Juan Rodriguez. He was a Chicano and he was part also of LLEGÓ. And he invited me to come in 1993 for the National March. And, you know, many of our sisters and brothers, they were doing a lot of work in the community, like Moises Agosto, Robert Vasquez Pacheco, Tony Molina, La Orquídea Venenosa, many friends that they were involved with our Dennis de Leon in New York, that he was doing a lot of work. So I moved to DC. I love DC, and I work with many agencies. I work with La Clínica del Pueblo and Whitman Walker Clinic. And then I work with LLEGÓ with a program called Siempre con Condón. It's always with a condom. And we create this kind of prevention, events. And I was also the co-chair of uno de los encuentros nacionales with Sylvia Evans. And, but for me, that was very difficult because I was working in my immigration papers and I was HIV positive and I was so scared. I remember that the doctor, they prescribed me the ACT and I was just taking, like hiding from everybody y con un temor terrible y leyendo la Biblia y el qué dirán and the stigma associated with being gay and being HIV positive. But little by little, they came the new cocktails, the prevention cocktails. And I really like that people like all my panelists, like we're preserving our history for future generations because what we live in the past, that was so different from now. So when people ask me, I say, yeah, we have the COVID-19, yeah. And I witnessed, when we have the AIDS epidemic in Atlanta, Georgia, and we have the first cases of AIDS with Latinos and Latinas. So I'm pretty happy that many of our sisters and brothers, they start creating prevention programs for everybody, and we need to just keep educating our community in a bilingual, form that we can, educate many Latinos and Latinas.
Thank you. I also want to acknowledge Ruby Corrado and the work that she's done in DC with Casa Ruby. I mean, the leadership that continues to evolve, connected to LLEGÓ or not, the fact that there are so many of us that are doing what we can to build and provide that network of support for our community is just so important. Octavio,
Alberto, can I say something very quick? I believe that the first grant that LLEGÓ get, that was from NMAC to provide technical assistance to organize a conference. I have in one of my archives a paper in which NMAC provide, I believe, $21,000 or $22,000 to work with HIV/AIDS.
That's correct. That was the first grant that LLEGÓ got.
Wow, thank you. Octavio, tell us a little bit about what you're thinking as it relates to stigma, and also how do you work for a national Latino organization? How do you guys talk about HIV and AIDS in our community?
Yeah, so just going quickly back a little bit of what I think this Beth mentioned earlier. So I came out in 1997. I was my senior year in high school, and very fortunate. My parents embraced me. They, you know, me, it was great. So, but HIV and AIDS kind of shaped my coming out, because after my parents were like, we love you. You're still our son. The first thing that came out of their mouth is, I don't want you getting sick. And I knew exactly what that meant, which leads me to LLEGÓ and the work that it was doing. And I can say it was pioneering work that it was doing with communities, with community-based organizations, and delivering HIV prevention, work. I was, like Laura said, I was a baby. One of my first assignments was to go out to Placita Olvera, because we were doing some, outreach with either, maybe it was Bienestar or Monsignor Romero, La Clínica Monsignor Romero out of LA, and doing work with outreaching to young men who were sex workers at Placita Olvera, and having a conversation with a young man who was undocumented and who was, surviving, and having to negotiate $20 extra so he could perform unprotected sex with his client. It was that kind of work and that kind of eye-opening experiences that LLEGÓ gave me, because I'm obviously, it just left the impact in the rest of my life, that how lucky I am and how I should be able to contribute back to my community as much as I can, because other people have it way worse than me. And that was I think that's the legacy of LLEGÓ and the HIV prevention work that it was doing. It was working in community, going into areas that people didn't want to work in. Talking to transgender people, working with people who just they needed that little extra help, and making sure that they got it, because other people turn away from them.
And
sorry, anyway, just went down a path there, but HIV was the frame. Yeah, HIV was the frame of my coming out, my experience as a gay man, my relationships, everything had the filter of safe sex and don't get sick, and the way, and my current work, we don't do direct work with HIV and AIDS, but we do, in our health areas, we do talk about promotoras de salud and how, health programs should be culturally and linguistically appropriate and work in communities instead of being very medical and clinical. And I think that's the extension of, of the work that LLEGÓ is doing in the early days.
Laura?
One of the reasons Octavio was doing that was there, and that Bienestar was doing that work, is that all of these big, well-funded organizations that were doing HIV/AIDS work were not talking to our communities. They did not have cultural competency. They did not, engage us in figuring out what were the best ways to reach our communities. I mean, that was another reason some of our organizations at the time, Bienestar, right, one of the biggest AIDS service providers in the country, was founded. It was a little committee. It was our little AIDS committee of Gay and Lesbian Latinos Unidos. And I remember with Reverend Carl Bean and Oscar de la O in my living room, we were plotting a protest against AIDS Project Los Angeles. It's like, we're going to go picket. We're going to, then it was like, screw it. Let's just start our own organization. Like, why do we need to keep fighting them to, insist that they serve our communities when we're the ones who should be getting the money, who should be doing that work ourselves? And so there were, it wasn't just about our identity, it was about the needs that our communities had that weren't being met. And at a time like AIDS, where it was a death sentence, that work was vitally needed. Those organizations were vitally needed.
And go ahead, Letty.
No, I was just gonna say, and Alberto Jose sent us some of the statistics of what's going on today, and we still have a problem in our community of HIV/AIDS and infection rates amongst Latinos and Latinas, I'm sure. And so, so the, you know, the work still needs to continue. And, you know, the sad thing is that we still have people who face the stigma of being gay. I heard a horribly sad story a few years ago. A young Latino gay man in South Texas died of HIV. His family had insurance. He just did not want to tell them that he was gay and that he was infected. And so he, as a result, ended up dying of HIV when it was totally preventable. But that fear that of coming out to, you know, his family prevented him from, you know, getting help. So, and that was just 2 years ago. So, and I was talking to Joey Pons, who was one of our board co-chairs years ago in Puerto Rico, who works in HIV in Puerto Rico. He says, Lefty, that stigma is still there. We kept dealing, we still are dealing with it. So I think what you're doing, Alberto, and the work that's continuing in like Bambi's organization and some of these other organizations is really still critically important to save people's lives, because we have to continue educating people that it is we are perfectly okay. This is, you know, yes, I'm a lesbian. Yes, you're gay. There, you know, there's nothing wrong with us, and we deserve to be, you know, to access treatment, to get treatment, and to get the, you know, be safe in our communities. And so, you know, this work is still very important. And I think the fact that, you know, LLEGO was focused on it was largely because, you know, most of the funding was the CDC grant. But I don't want to leave the conversation without also pointing out that the other thing that we were doing is we were trying to make inroads with organizations like National Council La Raza, Cosmo, LULAC, you know, all these Latino organizations that, you know, God, you know, we would have receptions at their conferences, and they'd stick us way in the back of the conference hall so that nobody would see us. But, you know, we were just insistent. We're Latino, Latinos and Latinas, we're part of this community, and we wanted them to deal with us. And I think over the time that came about, and I want to just credit Laura, because in the short time that she was at LLEGO, she was very instrumental in bringing some of this awareness amongst our Latino national leaders. And if and I just want to ask Laura to just mention that briefly, what you did with the National Hispanic Agenda. Yeah.
Well, Latino organizations did not think of LGBT issues as Latino issues.
Yeah.
Right? They were for the gay organizations, not for them. And so I was hired as the first director of policy at LLEGO. LLEGO had focused on programs and the AIDS work. And I moved to DC, and I was brought on as the first policy director to lobby Congress and to, you know, to try to impact policy. And that included, you know, I would go on the Hill to talk about, at the time it was the Family Marriage Amendment, which was to put into the Constitution that marriage was only between a man and a woman. And I would go to members of the Congressional Hispanic Caucus, and they're like, you're the first gay person that's come to talk to us that wasn't white. Like, I don't hear from Latinos, I don't hear from my constituents that they care about this issue. So it's hard for me to take a position. So it was really critical and strategic to get Latino organizations to start taking these positions so that we could say, you know, Latinos care about this issue. NCLR at the time was a hard nut to crack. You know, they're like, we don't take a position on those things. And eventually, you know, a number of national Latino organizations did, when it was presented to them as it's our community, it's me, it's Jose, it's Lisbeth, it is us that this is impacting, not those people over there. And it is discrimination. And you want to write discrimination in the Constitution, they're going to come for you next. And now everybody loves the gays. You know, we need
Well,
I don't know about that, but
the organizations.
It's our sexual preference. Bambi, you have to go, but and maybe just get Bambi to weigh in a little bit on stigma, since she has to go, and then we'll continue the conversation for the last 10 minutes that we have. Bambi, tell us why stigma is still so front and center.
I mean, from the beginning of the HIV pandemic, right? It was created as a morbid thing, right? I mean, it was the gay disease, right? It was
Cancer.
yeah, the gay cancer, right? Like only this group of people would get that, and I think obviously, the structures that we have within our society have been influential into crafting that sort of like way of thinking for our communities. And unfortunately, our peoples have been brainwashed for centuries, I mean, and that obviously, began with the invasion of the Americas, right? The indoctrination of religion and, all of those things, right? Like that we have been brainwashed to do. And HIV is not the exception to that, and even, I mean, just to give you a perfect example, right? The trans community is the community of all the communities that are most impacted by HIV, right? Yet in the trans community, there's still a lot of a stigma. Like many of my friends are HIV positive, including myself, right? But many don't talk about it openly because of the shame that many of us have, that many of us carry, but how that shame has been ingrained in our minds and in our hearts, really. So it's a continuous issue, but I think, although there's been efforts to sort of like try to figure out how we're going to combat stigma, the reality is that the stigma is hard to measure, right? It's sort of like a feeling, right? It's this feeling of shame, right? And so how do you measure that? And how do you, how do you make sure that you support those individuals that have those challenges? But we're not able to support those individuals if those individuals don't talk about it, right? And so it's a challenge, but I believe that we will win. That's what gives my hope. That's what keeps me going. I've been doing this work for a number of years, and of course not as long as Leti or Laura or Lisbeth or even Jose or anybody else, right? But the hope is that really keeps me alive, to be honest with you, because I know that we are contributing, or at least that I am contributing, or we as an organization, not just to the trans movement nationally, but also in some ways the Latinx movement, right? And the Latinx movement and the multiplicity of movements that exist within it, right? The immigration movement, the HIV movement, the healthcare, like women's, like all of these different movements that the Latinx community is part of. We know that as an organization, we're influencing because we are elevating our political, and obviously we need to also elevate our economic power. So I have to run because I do have another session, but I appreciate you all. I love you so much. And thank you so much for allowing me to share stage with this beautiful and amazing and incredible people.
Keep up the great work. So thank you so much. And I want to continue the conversation, and also before that acknowledge that we lost a pioneer in the trans movement, and as a recent member of the new NLGJA board in Monica Roberts, who just passed last week. It is very, very, it's a big loss, and I just can't, I still am at a loss, but I know that her legacy will continue, and will continue to find ways to promote those voices, especially the Black trans community. I want to kind of stay in this space because it was through Francisco Ruiz that works at the CDC and NLGJA that like looked at, okay, this is an important conversation to have. And so I appreciate that they've partnered with Honor 41 on this. But what do we still need to be doing? And what yes, go ahead.
Yeah, part of what I wanted to say is that, part of the groundbreaking work that LLEGO did that we don't even talk about as much anymore is that we had an international program that connected the immigrant communities to what it continues to be the pipeline of queer people who are escaping incredible difficult situations where prevention itself doesn't exist. It's not just Puerto Rico, where it's still a stigma, it's still, a taboo to talk about who in our communities is positive, but that in the queer community, in particularly in Central America, the models that LLEGO seeded are still working, right? As somebody who still is in touch and who still works with organizations in El Salvador, in Nicaragua, in Honduras, right? That works with the trans community, in San Pedro Sula, in Tegucigalpa. San Pedro Sula, if not the most violent city in the world for trans people. We don't talk about this. LLEGO was doing work in these cities when nobody was talking about what did it look like to relocate a person from Central America to Europe, because they couldn't come to the United States because they had a record that avoided them that avoided them from touching in here. Let's drive. I have this memory of driving an AIDS trans activist from San Pedro Sula to Acapulco so that they could take a flight directly into Norway because they couldn't land in the United States because they would be arrested, and they couldn't land anywhere else. In that, we called upon our siblings, and we all stepped up, and we got people in that, relocated in ways in which they are now in Europe also doing work. And one more point that I want to make sure we talk about is that, we talk about La Raza, and we talk about LULAC, and we talk about some of the other national, NALEO and others, but our own queer organizations that, these white organizations we were talking about, we're also not stepping up and doing the work. When you have to go toe to toe with other queer organizations about the fact that votes to take away their rights are happening in Miami, in a Latino city, and you decide that you're not going to do anything to target the Latino community in Spanish or English because they're all bigots, we don't want them. At that particular point, and these are the folks who also had people sitting in boards that were giving us money, we were trying to get money off them, that we couldn't do that. And so for us to then cover the money, and Laura knows exactly what they look like, because we had to cover the money to put ads in, in Southern Florida to defend this is the Save Miami, Day campaign, because it was issues around AIDS, it was issues around representation, it was issues around, protections of the municipalities that compose Southern Florida in the Miami-Dade County. I still owe my coffee addiction, not to the fact that I grew up in a coffee farm, but how many hours I spent in, in Little Havana drinking coffee with Cubanos playing dominoes, in the little, it's like, okay, here's a colada and have a shot and have another, it's like 3 days later, you're like, okay, I'm still working. Yeah. But that we did that because we knew, just like Laura said, that if we allow these things to happen as, if Latino organizations allow these things to happen at the local, at the state, or at the national level, what stopped these people working against us to going after them? What stopped these organizations from going after us, not just for being queer, but then for being Latinx people? And, and we drove that message home every day. We stood in panels on the CDC, in, anywhere we went, and we said the same things, like if we don't prevent HIV/AIDS in these communities, if we stop not just the prevention, but the treatment monies in these communities, how are we going to stop them from doing it from the so-called straight communities? Because they know they're immigrants. Oh, they're this. And for complex communities like the Afro-Latinx community, what did that mean? You couldn't go to Black organizations because you were not Black enough. You couldn't go to Latinos organizations. It was the ways in which we dealt with all of those things meant a lot of internal conversations, a lot of internal discussions, but commonality on the fact that we were going to do this work because we knew that if we didn't, then who? And the answer, we have it today. Llegó is no longer here, or as many of us joke sometimes around the world, llegó, se fue. And now what? Who speaks for us in those circles? And if not us here and those who are watching and those who rose through that and are now in positions of leadership in other organizations, these are the moments in which you need to continue to speak up. So, you know, I just, it has to be put out there that we have to talk.
And in fairness, you know, this panel does not represent everybody that was a part of LLEGO. There are a lot of other national leaders that have done some important work. Dennis de Leon, Richard Saldivar, Oscar. I mean, there's so many people that have contributed to this. So this is what we call a mini reunion. Obviously, I think there's more conversations to have that I think we need to have. And I think jokingly, Lisbeth and I talked about actually generating money to have an encuentro so that we can come back and start talking about who right now,
yeah, but we're not organizing it, right? We're just getting the money because I don't want to organize.
But why can't we have a group? Why don't we have a group now? Why don't we have a voice, that united voice now? Can we repeat a LLEGO or a version of that? What do you think, Laura? And then Letty, and then Jose? And everybody will weigh in on this. It'll be our last question. Laura?
So I have to say that the evolution of Latino organizations have come so much farther in accepting and embracing not only LGBT people, who every Latino organization, national Latino organization that I can think of, you can point to open LGBT leadership in those organizations. The president of Hispanic Federation is a gay man. You know, where Octavio, you know, has worked for the president of Unidos US for how many years now? You know, you had Ruben, you had, you know, where Latino organizations, national Latino organizations, when we call on them to take a position in defense of LGBT people, we count on them to do it, and they do it. Gay organizations, to take a position on issues that impact our communities, on immigration, on those issues, they're not there for us. They're not there for us. So I'm very proud of the work of our community. You know, it doesn't mean, you know, we don't have obviously more work to do, but I'm very proud of the Latino community, the response, people like you know, executive directors, presidents of Latino organizations, you know, who are openly gay, who are embraced by those communities, who are respected by their peers. We don't see that happening in the gay organizations. And I feel like I don't have the time to work on them. I want to work.
Well, we'll work with you on getting the money, Lisbeth.
Yeah.
Other people can organize. We'll get the money. All right. We'll have everybody quick closing statements on this issue. Letty?
Well, first of all, Alberto, I just want to thank you for having us, and also you're doing the work of making us visible, and making our, not just our history, but what's going on today visible, and that's really important. I've always said that is really what it's all about, because if we go off and are invisible, no one is really going to take the time to get to know us, and we're not going to get to know each other. So I think what's going on here is very important. I just want to thank you very much for giving us this forum.
Thank you. You're welcome. And if not us, who, right? We just have to stop waiting. We're not going to be asked or given a seat at the table. We have to create our own, or at least show up with our own chair, but they can't keep us down. And last closing remarks for Octavio, and then Jose, and then we'll close with Lisbeth.
Sure. Well, thank you again for hosting this. This is wonderful. It's great to see so many friendly faces from where I really did get started, where the formative years of where I got where I am today. So I really do owe LLEGO a lot. So to Laura, Lisbeth, you were there from the beginning when I was at LLEGO. So thank you. But the one thing, going back to your question about, is there about creating a Latino LGBT or queer organization? I'm from the mindset very similar to Laura, that I'd rather be at a Latino organization being loud and proud and comfortable with myself and knowing that I can make a difference within that community. And I think there's a lot of power in that. It was something when Unidos US back then, it was National Council La Raza, raised a rainbow flag outside of our headquarters for Gay Pride Month. It was a huge moment for me. And it was, and I can tell you, it was a long, journey to get there. Because of YEGO, I'm able to go into a Latino space, and not be afraid to be gay, and just come in full 100% myself and be authentic. And would I be up for another YEGO? Sure, but I'd rather stay, integrating gay issues into the mainstream Latino organizations.
Great. Thank you. Jose?
First of all, I want to thank you, Alberto, en honor 41, y también a José Luis, que nos ha estado ayudando. Thank you, thank you, thank you. Yeah, well, I think it's important to preserve our history. I don't know if we have more energy to create another organization. I do remember that after YEGO closed the doors, that was El Timón, and then Unidos, in which I was working with Bambi and Lisbeth and Jorge from Chicago. And I want to take this opportunity to thank Lisbeth, because she was our executive director of Unidos, and she made wonderful contributions. But I want also to mention people who were before us, like Silvia Rivera, like Jose Sarria, Jen Cordova. She was a Latina lesbian who was with the Daughter of Abilities. Jack B. Garland, he was a trans man who lived in San Francisco in 1869. Tony Segura, and many, many, many sisters and brothers.
Paul Ramirez Murphy.
Yes, and many, many sisters and brothers, that it is important to have the histories, the stories, and all the contributions. But I'm very happy because I start my new project, Jose Gutierrez Archives, and now I'm working in my web page. So I'm very happy because I'm going to.
You're preserving our history, so thank you so much. Lisbeth, you'll give us our last closing remarks from the panel.
I guess. So I will say this. I think that if there is to be a new version of YEGO, it has to be born of the people who are in the field now, people who will, I wouldn't say, who will learn from both the great things YEGO did and the mistakes that we made, and make it their own. I think that for some of us, I straddle both worlds still. I still work with queer organizations. I work with Latinx organizations. And I agree with Laura 100% that it is amazing to see the amount of gay, of queer, LGBTQ leadership in high positions that Latinx organizations have at this moment. It fills me with pride every time I look at NLAAD or at the Federation.
United We Dream.
United We Dream, even movements outside of the Latinx, like Black Lives Matters, have founders and leaders who come from the Latinx, diaspora. But I do think that there is still a need for a voice. I do think that there's still two things that are, clearly with the same energy that we work for Latinx organizations to integrate us into their leadership. We need to work with queer organizations to give us voice, because we are still there. And we should hold them accountable when they speak, that they cannot speak in dichotomy ways, and they cannot ignore immigration, because at the end, these are queer issues. And if you think they're only affecting Latinx people, you are wrong. And that is something that we say at the tables all the time. So my challenge is, look, for those of us who are not sunsetting, but have moved on elsewhere, though I dream of retiring, I'm not as close as Letty is, because
Yeah.
It's amazing what the government work will do. Like my mom retired at 55. I'm 55 now, and I'm like, I'm never gonna retire. But that we do need to have a voice, and we need to find a place for us to be able to integrate all those things.
Yeah.
Does it have to follow the model that LLEGO did? Absolutely not. You know, we've seen other models work and not work, and I think eventually that will happen. I think young people will figure out a way to do it. They are amazingly smart, amazingly wise, and we have a lot to learn from the energy that comes out of those circles in current circumstances and with issues that affect the millennial and Zers in which that they were not affecting us. We had AIDS to bring us all together at one point or another. They will find the issues that will bring them to the table together, in which they'll need to find common voice and a way to amplify and elevate their voices. And so
well, thank you.
the challenge for those, for us, to keep mentoring so that they can do it.
Yeah, mentoring I think is key. And I think even in this group, I know that there have been layers of connection and support for one another. I know again that I could have had an hour with each of you. So I know that it's tough when you have so many folks on that we could have heard more from, but we had an hour and we're already over. But I'm going to pledge that this is just the start of a conversation, and that we can continue to have the dialogue so that all of you can not only speak, but we can also add other voices that have made a big difference in the work, but are also voices that are leading the work moving forward. Thank you very much for sharing your stories. I really, really appreciate the fact that you're sharing them, that we can amplify them. And special thanks to NLGJA, of course, the CDC and Francisco Ruiz, so I don't think this would be happening without, and of course, Honor 41. We'll have Jose Luis close us up.
Thank you, everyone. This is a great conversation. I learned a lot. Thank you for your time and for your service and your commitment to our communities. This webinar was supported by NLGJA, the Association of LGBT Journalists, the Center for Disease Control, and Honor 41. To learn more about this campaign, please visit nlgjA.org/new ways to learn more. And please share this conversation with your families and friends, and let's keep the conversation. Thank you for your work, and thank you for joining us today.
Thank you, everybody.
Thank you.
Thank
Thank
you.
you so much.
Ciao.
Bye-bye.